Welcome to India TV and you're watching HealthDNA, and on this World Heart Day we have Dr. Nishith Chandra, Principal Director, Intervention Cardiology, Fortis Escorts. Welcome sir. Welcome sir.
Thank you.
So what is heart disease?
So जो हृदय रोगी जो हृदय संबंधित जो प्रॉब्लम्स होती हैं, डिजीज़ होती हैं, उनको हम हार्ट डिजीज़ के दायरे में रखते हैं. Heart disease can be classified in a number of headings, like it can be ischemic heart disease, rheumatic heart disease, congenital heart disease, peripheral heart disease. So ischemic heart disease का मतलब होता है कि जब हार्ट की आर्टरीज में ब्लॉकेज हो जाती है. That is the commonest form, and this is the basically ischemic heart disease carries this heart attack, angina, all these problems. Congenital heart disease जो होती है, that happens since birth. So आपने सुना होगा छोटे बच्चों को हार्ट में होल होता है या ब्लू बेबी होता है. So that is called congenital heart disease. That means heart disease happening since birth. Then another thing, this type of heart disease which is very common is rheumatic heart disease. Like in this, what happens is during childhood, early childhood, person develops rheumatic fever. Sore throat होता है, sore throat के बाद rheumatic fever होता है, और sore throat की वजह से जो rheumatic fever का जो बैक्टीरिया होता है स्ट्रेप्टोकोकस, उससे कुछ ऐसी एंटीबॉडीज़ निकलती हैं जो हार्ट के वैल्व्स को डैमेज कर देती हैं. तो आपने सुना होगा कि वैल्व्स या तो सिकुड़ गया है या लीक करने लगा है. सो दिस इज़ कॉल्ड रूमेटिक हार्ट डिजीज़. देन अगर हार्ट के स्ट्रक्चर के हिसाब से हम क्लासीफाई करें तो पेरिकार्डियल डिजीज़, हार्ट के चारों तरफ की जो मेम्ब्रेन होती है उसको उसमें इन्फ्लेमेशन स्वेलिंग आती है. सो दैट इज़ कॉल्ड पेरिकार्डियल हार्ट डिजीज़. Another type of heart disease which is common after COVID, which is आपने देखा होगा कि हार्ट की मसल्स वीक हो गई हैं, कार्डियोमायोपैथी हो गई है. सो दैट इज़ कॉल्ड कार्डियोमायोपैथी और मायोकार्डियल डिजीजेस, हार्ट डिजीजेस. सो ये डिफरेंट कैटेगरीज हैं जिस तरह को हम जिस तरह से हम हार्ट डिजीज़ को क्लासीफाई करते हैं. जो कॉमनेस्ट है और मोस्ट ड्रेडेड है, दैट इज़ इस्केमिक हार्ट डिजीज़.
So sir, what are the risk factors leading to it?
There are many risk factors for developing heart disease. Some of them are modifiable risk factors and some are non-modifiable. Modifiable means which you can have, the risk factors which you can control. What are these? Like smoking, like obesity, like sedentary lifestyle, like development of a diabetes. All these modifiable risk factors can be treated, you can work upon that. If you are diabetic, get a good treatment from a diabetologist. If you are obese, you reduce your weight. If you are sitting all the time on chair on a laptop, so you can be active, do exercises. If you are smoking, then quit smoking. So these are the modifiable risk factors. There are certain risk factors which are non-modifiable, which you have no control over, like genetically you are predisposed. If in a family your parents are having heart disease, your brother, siblings are having heart disease, so you are genetically predisposed for developing heart disease. So you cannot modify these risk factors. You cannot change your father or mother, but if you have a history of this genetically predisposed heart disease in your family, then you can be alert and at least work upon your non-modifiable risk factors and get yourself frequently checked up with a heart consultant, so any disease which is developing can be detected quickly.
So what are the signs of an unhealthy heart?
When this pump starts getting weak, then the person starts having weakness, fatigability, breathlessness, palpitation. Palpitation means he is aware of heartbeat, whether it is fast or slow, or he may develop giddiness, he may pass out, what we call a syncope, or the most common of them is developing angina, which if not treated in time can lead to heart attack and cardiac arrest.
So why do we see a rise now more in heart cases then?
So it is a reality that we have been seeing these disturbing trends of young people suddenly who were previously well, suddenly dropping dead while doing treadmill or doing some exercise or even dancing or running, dropping dead suddenly. Now, this is what I want to emphasize, that there is no thing like sudden. This means they must have definitely ignored some subtle signs and symptoms which they should have actually pondered over, and they should have got some early consultation from their heart disease. Most of these people who died suddenly have certain arrhythmias which are congenital. The numbers of them, like long QT syndrome or LGL syndrome or HOCM, which is a cardiac myopathy which causes sudden death. So these types of diseases, sometimes they don't have any symptom, but we can detect it if the person comes to us for the examination. So the message here is that after 40 years of age, person should at least come for a checkup from a cardiologist.
So what are the tests available?
So the simplest test is a 12-lead electrocardiogram. So this is a very simple, it's available in most of the remotest centers, and it takes only 5 minutes. And now the technology is so much advanced that there are smart watches available. The ECG can be done on your watch also. Here also I can demonstrate on this watch your ECG. So ECG is basically nothing but we pick up the electrical signals from the heart, because heart has a very intricate electrical signal. So it has a natural pacemaker, it has a array of conduction wires sort of thing which transmit the electricity from the upper chambers to the lower chamber. So whenever there is a problem with these electrical system of the heart, whether being in a pacemaker or in these wires, then the person can develop these arrhythmias, which we call a slow heart rate or a very fast heart rate, and even cardiac arrest, sudden stoppage of the heart. So ECG does nothing but picks up these miniature electrical signals and amplified, and we record it on a tracing paper. So that is how we diagnose a variety of diseases like arrhythmias, like angina, like electrolyte imbalances, like cardiomyopathies, and of course heart attack. So ECG is the basic first test for heart, and it takes only 5 minutes. It's a non-invasive procedure. The second is echocardiogram. Now, echocardiogram is nothing but is an ultrasound of the heart. Again, it's totally painless, non-invasive, takes only 10 minutes. And on echocardiogram, we see the heart live on the screen while it is functioning, while it's pumping. We see all the wall motions, we see its pumping power, ejection fraction, what we call it. We see all the valves which are functioning, or we can even diagnose any hole in the congenital heart disease in small children. So echo is very, very important and very non-invasive, and takes only 10-15 minutes only. The third test is a treadmill test, and in treadmill test is simply an ECG recorded while a person is exercising. Now, there's a very common myth people have. They go to a cardiologist, they get their ECG done and a echo done, and the tests are normal, and the next day person has a heart attack or something, and then they start complaining that the doctor said everything is normal, then why I... So ECG and echo only shows what is the current status of the heart, while the treadmill shows what is going to happen in the future. Because during the treadmill test, TMT test, or we call it in a common parlance, it's stress test. We put the heart on a stress, and during that stress we continue to record the ECG. There are certain gradations of exercises, there are certain protocols, and if the person has passed the TMT, then the chances of heart disease are much remote. So there's no one test which can conclusively prove that your heart is healthy. which test is required, you should leave it to cardiologist, because he, according to your symptoms, according to your risk factors, he will guide you the best that which is the test which is good for you.
So how stress is linked to a heart condition?
So stress is directly related to heart. Stress, if it is short-lived, it is beneficial, but if it is chronic, it becomes chronic, then it starts affecting body organs adversely. And the most dreaded complication of prolonged stress is heart attack. Now, during stress, there are certain stress hormones which are released, and they causes increase in heart rate, increase in blood pressure. So the heart has to pump with more force, and that can cause, if stress is not treated or not basically controlled, then uncontrolled chronic stress can lead to development of high blood pressure and heart disease. You should start doing yoga and meditation. That basically makes your body immune to the adverse effects of stress. You will become mentally more stronger to take on all your day-to-day life stresses well.
So heart health in women is often missed or dismissed. Do you also see that? And what are the signs? Are the signs different in women of heart conditions?
So women are basically protected from heart disease up to their menopause because of the estrogen hormone. But after menopause, the chances of developing a heart attack are same as in women as in men. In women, but when after menopause the heart disease develops, it is more severe, because in women the coronary arteries, or the arteries which are run on the surface of the heart, are narrower than the men. So in women, when the heart attack occurs, the consequences are much worse than in men. Then the symptoms of heart attack or angina in women are slightly different from what they are in men. What is the difference? The difference is they may not have a typical symptoms of squeezing chest pain, breathlessness or sweating. They may have a very subtle symptoms like vomiting, nausea, fatigability, breathlessness, palpitation. So in women these symptoms are different. In women, some of the tests actually, like a treadmill test, can throw a false positive result. Means it may show an abnormal result while the arteries were normal. Then in women there is another entity which is called syndrome X, or they may have typical symptoms of angina or chest pain with the normal arteries. So here this is, in medical terms we call microvascular angina. So women are prone for that also. So these are the basic differences in women and men.
So often there is confusion between cardiac arrest and heart attack. So what is the difference?
So you must understand the difference between these three terms: heart attack, cardiac arrest and heart failure. So let me take them one by one. The most dangerous of them is cardiac arrest. So basically it's an electrical phenomena, where I earlier told you about the electrical system of the heart. When the electrical system malfunctions, the heart suddenly stops beating. So this is called cardiac arrest. Now why it is so important? Here, if you don't give treatment or you bring back the heart by defibrillation, within next 3 to 4 minutes, the person's brain will die forever. So you have only 3 to 4 minutes. Now you may ask that in 3 to 4 minutes you can't expect a doctor to reach or an ambulance to reach. So what should I do? So here my message on this World Heart Day to everyone is that you should learn cardiopulmonary resuscitation. It's a very simple thing you can learn in 10 to 15 minutes only. In our hospital we organize regular free training camps, where what you can do is, if you witness somebody having cardiac arrest in your workplace or in your home, you can start CPR without losing your time and alert your nearest heart hospital to send an ambulance, because you can continue CPR for a certain period of time. You can get tired. So you have to alert the nearest heart hospital for the ambulance and the defibrillator, and continue CPR till that. And once the medical team arrives, they have definite gadgets called automatic external defibrillator. They can bring back the heart by giving a shock. The second entity is heart attack. Now, heart attack is a problem where there is a blockage of coronary arteries which supply blood to the heart muscle. Blockage is because of initially because of plaque building because of the cholesterol, and then sudden clotting of the coronary arteries. So the blood flow to the heart muscle is stopped, and the person then is having squeezing chest pain, sweating, breathlessness, and you even pass out. So that is heart attack. Now the difference from cardiac arrest is, in cardiac arrest heart is not beating. In heart attack heart is beating, though with the blocked arteries. So here also there is an emergency for the treatment, but it's not that you have only 3 to 4 minutes. Here, the moment you witness somebody having a heart attack or heart attack like symptoms, again you don't have to waste any time. You should alert the nearest heart hospital to send their ambulance. If the ambulance is getting time, you take the patient in your car. At home, what you can do is you can give him half glass of water with the dispersible Disprin in that. Here the Disprin is not for the pain but is a blood thinner. People do sometimes a mistake of giving him a sorbitrate, which is a nitrate like medicine. Now sorbitrate sometimes causes sudden drop in blood pressure. So for established heart attack, sorbitrate should not be given at home. That's a very common mistake people do. So you should give a dispersible Disprin, which is a blood thinner. So, and then don't waste time, because again every minute counts. The earlier those arteries are opened in a hospital, the better. Here the window period is between 60 to 90 minutes. So 1.5 hours about. Unlike in cardiac arrest where you have only 3 to 4 minutes. The third term which I wanted to explain is heart failure. Now heart failure is what? Heart, as I told you earlier, that heart is a pump. When the heart fails to pump blood effectively, this is heart failure. Means when the heart becomes weak in pumping the blood, then this is called heart failure. Here the commonest symptom is breathlessness, weakness, swelling over the feet. So this is heart failure. Heart failure, the causes of heart failure could be again blocked arteries, it could be post-COVID cardiomyopathies or viral cardiomyopathies, or even after untreated rheumatic heart disease, heart can become weak. So then can ultimately lead to heart failure. So on this World Heart Day, if you understood the difference between cardiac arrest, heart attack and heart failure clearly, then I think my job is over.
So talking about COVID, do you think there has been rise in heart cases post-COVID?
So unfortunately, yes, we have seen a disturbing trend of sudden heart issues, sudden cardiac deaths, and increase in incidence of myocarditis. Myocarditis is what? It's inflammation of the heart muscle, which we diagnose by simple echo and an ECG. So there is definitely a link between COVID and heart disease. So, but you should not be afraid of that. If you have had a severe COVID in the past or during the past 2-3 waves, what you should do is you should get your heart checked by a simple echo and ECG, which are non-invasive, takes only 15-20 minutes. And if your heart is fine on that, then that means your heart remained untouched by the COVID.
So what would be your message on World Heart Day? How can we keep our heart healthy?
So on this World Heart Day, my simple message to our viewers is that identify the risk factors which I told you, work upon the modifiable risk factors, stop smoking, increase your exercise levels, do some meditation, reduce your weight. If you have diabetes, control it by simple diet and medicines, and get yourself frequently checked. Frequently means once a year or twice a year by a trained cardiologist for early detection and then its treatment. So this is my message. Now the science is so much advanced that we have treatment for nearly every heart disease, but only if it is detected in time.
Thank you so much, sir, for giving us your time. It was a pleasure talking to you.
Thank you.
for joining
Thank you
us.
very much.
Thank you, sir.
Thank you.